Hi, my name is Roman McInerney. I'm a fourth year medical student, also an MPH student, and I'm here to talk about my PHP. For my particular project, what I had actually looked at doing was a transgender health needs assessment for adults in the state of Texas. So, first, I'm going to just give you a little bit of background about it. As a student, I actually founded the LGBT organization. Back in 2014 when I started at UNTHSC. So I've done a lot of advocacy work for this particular group. I myself am an ally, and one of the reasons I started the group was just to kind of show some solidarity. Also, I felt like there was a need for some LGBT advocacy on campus, with Fort Worth being historically a more conservative city and medicine being a somewhat conservative profession. I felt like that was something that you needed to have an overt statement about the campus being LGBT friendly. So I started the group. I did a lot of work as far as clinical education and everything for the students, just to be aware how to approach patients who are LGBTQ. And when I was looking at my public health project, I thought that it would be nice to tie in my advocacy work with this. And so initially I had actually planned to do something related to a JPS sponsored transgender clinic. And the reason that came about was because I had met an intern named Dr. Alex McBath during my third year medical school, and he informed me that they were planning to open a transgender clinic. And so that was something I was planning to do my project around at that time. I moved to San Antonio for my fourth year of medical school, and I came to find out they had their own transgender clinic sponsored by the medical school in San Antonio. And so initially I planned to do parallel analysis of both clinics. Unfortunately, with the UNTHSC selling the doctor groups and everything, the clinic fell through for JPS. Nonetheless, I was advised by one of the med students who actually was the point of contact for the transgender clinic in San Antonio that I could look into doing a health needs assessment for the DFW area in case they were going to look to reopen the clinic in the future. And so I decided on that. And then I asked the advisor for the LGBT group, PA Vic Holmes, to be the principal investigator. He agreed. He was very excited about it. He's been proactive in the LGBT community for quite some time. And so he had a lot of good contacts that he allowed me to network with. And so I'd say around November, the project started taking off. I'm doing my research on how to design the survey, how to decide the health needs assessment. I decided to do an online platform simply because I could reach more people more easily, as opposed to driving up to Fort Worth from San Antonio and going to meetings and handing out paper surveys and having them filled out. It just is going to be logistically easier for me. Plus, I knew I wanted to synthesize the data and hopefully publish some good information as far as the findings. And so, again, that seemed to be easier to do if I had a online platform. I opted to use SurveyMonkey simply because I feel like it's a better platform as opposed to Qualtrics. I did have to pay out of pocket for it, which was something I just had to deal with the cost. But I do feel very comfortable using this particular platform. In researching the survey questions, how to design them, because I really had not designed a survey before, I came across Canadian AIDS Society transgender survey from I think 2014. I called them to see if I could use some of their questions because I really like their questions, and I ended up speaking with the director there, Gary LaCase, and he gave me some really good advice. He said when they designed their survey, they had not consulted the transgender community, and so there was a bit of backlash because they felt it was unfair to be attempted to be studied without them essentially being asked about it. And so I made it a point to really do my homework on the transgender population and get them involved with the designing of the survey, just so they felt comfortable with it. And so I ended up meeting with a person by the name of Finn Jones. He's transgender. He's very proactive in the DFW transgender community. And a person, Dr. Renee Baker, she's also transgender and treats a lot of transgender patients. And so I made it a point to meet with them in person and get their feedback on the survey questions I was designing. And so I got a lot of great feedback, a lot of great support too, because I think it's important to note that as an ally, I have to be careful because it's not my story to tell. And realizing this is a very vulnerable population, I want to make sure that I do this right. And so they were both very excited about the survey. I ended up changing a lot of the questions based on what they had suggested. And then in February, actually, I went to a Out for Health conference, which is a conference held every year, and it's for health professionals that are students, medical students, PA students. And this past year, well, this is a statewide conference, and this past year it was held in Austin. And one of the key themes was transgender health. And so I met a Dr. Madeline Deutsch from the University of California, San Francisco. She is transgender, and she also has an MPH. And so I was very fortunate to come across her, and I asked her about designing the survey, the questions, and it was just kind of for me, I wanted to make sure I was producing good questions that could produce good data, good research, because one of the goals of this survey is to actually be able to utilize it in the future, not only for meta-analysis to make comparative studies between the population of Texas and other places, but also so it can be used to advocate for allocating funding towards transgender health, I should say. And so I knew in order to do that, I would have to have valid questions. And so she really helped direct me to be concrete with my questions and to ensure that I was doing something that was not only sensitive to the community, but also scientifically sound. And so with that suggestion, I ended up opting to use a lot of previously validated questions that came from other transgender surveys that have already been published. And so that was very advantageous because using the validated questions, you can make those comparisons with other studies, and it makes the IRB process a lot smoother. The IRB process has been something of a learning curve for me. When I first started inquiring about getting the survey approved in January, I was told it might take a couple of weeks because it was just a standard survey. However, it ended up taking a lot longer. It's still undergoing IRB approval right now, so unfortunately I don't have actual survey results to show because I haven't even launched the survey yet. So my project is basically around the development of the survey. The IRB is very strict when you're collecting survey information that's not necessarily anonymous. And so although I'm not asking date of birth, name, email address, anything like that, I am asking county of residence. And the reason I'm asking that is because I want to see how the distribution is for the healthcare needs within the population, the transgender population of Texas. And so to me, it's a particularly relevant data point, and I don't want to give it up, but it makes the survey not anonymous. And so they make a very good point in that if somebody answers the survey, they list where they live as far as county, because I'm also asking age, demographic, race, things like that. And so it wouldn't be too hard to ascertain somebody's identity. And of course, that could lead to a number of repercussions for people if their data is breached. They could be embarrassed. People may not know their job. Other things are at risk. So I had to write up the protocol synopsis, very specific with privacy statements, confidentiality, making sure that people are aware of the risk that this entails. I also have to list the security measures I have in place with my survey platform, SurveyMonkey, as well as what we're going to do if we have a data breach. And all this is very involved. It takes a long time. They want to know exactly where the survey will be posted, how it's going to be shared, who's going to email it out, what are you going to do if you need to get in contact with these people because there's been a data breach. So it's been a very, very involved process that honestly I didn't anticipate it being as long as it is. Fortunately for me, since my PI will still be associated with UNTHSC, I can still work on the survey and the results and publish it under UNTHSC's IRB once I graduated, because after I graduate I will not be associated with the university anymore. But since my PI is, I do have the opportunity to still work on it, and it's very close to my heart. I do want to produce good results that are accurate and can help people in the future. That's really what the focus of this is. So it's been a great learning experience for me. I think that I want to do more surveys like this, and now that I've actually had this experience under my belt, this very real-world experience of dealing with the IRB, I think that I'm going to be just that much better of a public health professional. So We're about the 10 minutes now, so I don't want to go over my time, but I thank you for listening to me. No visual aids or anything, because I didn't actually produce any results, but hopefully my narrative was able to provide you with the information you needed. Thank you for your time.